Today we're going to be hearing about some innovative approaches to dealing with Israel's major mental health challenges. I'm Bruce Rosen from Israel Healthcare Highlights, and my special guest today is Efrat Stern. He's the director of JDC-Israel Unlimited, as well as JDC's Mental Health Initiative. Before we get into the innovative work, please tell us a bit about yourself, Efrat.
Thank you. So I work for JDC for the last 13 years, always in the department of Israel Unlimited, which is the department that our goal is to improve independence life of people with disabilities. In the last 6 years, I'm the director of this department. And somewhere along the COVID pandemic, we understood that the mental health issue will be one of the most important things that the state of Israel is, as other governments in the world, will have to deal with. So since then, I'm also the director of the Mental Health Initiative, which looks not only at people with disabilities, but about all the people in Israel. And of course, what was relevant before October 7 is now even more relevant for what we're doing.
Terrific. So happy to have you with us here today. So please tell us a bit about what you and others at JDC are doing to deal with this massive, massive challenge.
So we understood very fast, as I said, that it is about all of us. It's about me, my community, my family, and we understood that we have to work in two main ways. The first one is to see how we are creating a wide range of interventions for people, so everyone will have the specific intervention for him or her. We understood that we will never have enough therapists or professionals, so we have to have wide range of solutions. And
we of course being not just JDC, but the state of Israel as a whole, right?
The state of Israel, the government, other NGOs in the ecosystem. And the other thing that we understood is that we have to build infrastructure, good infrastructure like data resources, seal of quality. So we will promise that we will have enough ways to give everyone quality and effective solutions. So what we're doing, I'll give a few examples.
Terrific.
One example is that, of course, you said it's a very, very big problem here in Israel. And so, you know, that big problems, we have to have big solutions. And when we look at big solutions, we look at technologies. We understand that there's a big potential in technologies for the mental health interventions. So we are working with a few of technologies, which we understand there's a big potential for them to be very, very good and to go to big scale very, very fast. So for one example I can give is the Dugri platform. Dugri is like real talk, or, you know, like we speak here in Israel. And what Dugri is doing is that it creates a community, a peer-to-peer community. It can be an anonymous community. And everyone there, the participants, can feel very, free to say what they think and to give advice to one another. The first community that we created is community that the name is Tav Shmone. It's for the wives of the reserve soldiers, which we have really very good impressions for them, that it really helps them.
Okay.
So we took this platform, we translated to Hebrew, it was in English, and now we understand the good things, the pros, the good things that there's in this platform, and we're going to create more communities, like for reserved soldiers themselves, for youth that is going to go to the army next year, and so go on. So this is one example.
That's good. Wait, let's just hold a minute on the wives of the reservists. So how many people are, or spouses of reservists, how many people are using the platform now?
Above 1,000.
Excellent, excellent. And they find it to be useful to them. That's great.
Yeah, yes, one of them just told us that it is very good. She don't know what she will do if there will not be a Dugri platform, because it's the way for her to share with someone how she feels, how our day is looking, and to feel like normal, that it is someone that everyone deals with.
Terrific. So we've heard a bit about the technological angle. You want to tell us about some of the other work that you guys are doing?
Yes, so another example I can say that we understood that if a person in Israel feel like a need to find some kind of solution, so the first thing that he or she does is just to Google what are the different interventions. But we know that not more than 30% of the interventions are quality enough, and it is exhausting to find one intervention, another one in all the search engines. So what we did is that we built a platform that the name is Nafshi 3 weeks after the war began. And this platform, there's almost 800 different solutions. We vetted all of them. We know that they're quality enough, and people can just go into this platform. It is very personalized. I can say, I'm 49 years old. I live in the Sharon district. I want to have help how to talk to my children about the war, and it will give me only the recommended ones for me. Until now, there are more than 200,000 people that use this platform.
Wow. Wow.
And we want to integrate AI tools to make it even more precise and to give better recommendations for everyone.
Now, why would someone use this rather than just going for advice to their family physician or to the health plans, psychologist or psychiatrist? Why this sort of response?
So you know that you can go to your MD in the HMO, but not all the time you will have or she will have the right solutions for you, what to offer. And to go to the psychiatrist or the psychologist, you can wait even up to a year, at least here in Israel. We will never have enough professionals, but even more important, most of us, we don't need the professionals. We can get a lot of help from other solutions. But what we do in Israel is that we go directly to the professional, and we should like change the set of minds so we can use other interventions too.
That's great. We only have a few more minutes. Can you tell me a bit about some of the work that you're doing at the community level as opposed to just the individual level?
Of course. So we're now in the beginning of a huge project in almost every municipality in Israel. It's a big project. Is led by the Ministry of Health, the Ministry of the Prime Minister, the Ministry of Finance, 8 different ministries, and of course JDC. And what we're doing is that we understood that the people in Israel, we need really fast interventions, and the one that know best what interventions are the recommended for their residents are the municipalities. So in every municipality in Israel, there is now a health coordinator. The responsibility of the health coordinator is to map the needs, is to build a strategic plan, is to work with all the stakeholders in the municipality to understand which kind of interventions they want to implement in the municipality. JDC is with the government is working to train these health coordinators. This is one thing. The second thing is that we build like a digital library. We advertise a tender, and over 70 different interventions were vetted. They will be on this digital platform, and the municipalities can choose from them what kinds of interventions they want to implement in the municipality. It's, I think, maybe the biggest project today in Israel in the community level and with a
Wow.
lot of ministries.
Efrat, that's so impressive and so important. Thank you so much for, first of all, for being with us here today, but also
Of
to
course.
you and all your colleagues for the important work that you're doing. Do you have any wrap-up sentence you want to leave our audience with?
I want to say to our audience that first thing, our emotional needs are everyone. We all have emotional needs, and I want to say that to say to all the people, go find yourself the specific thing that you need and can help you, and think in a like outside of the box of what can help you. Together, we will create a better reality for all of us.
Thank you.
Thank you.